Hello and welcome to episode 4 in our CCF video mini-series. Today we are going to talk about why cancer survivors slip through the cracks. My name is Mindy Dykes. I'm a community outreach coordinator for Children's Cancer Research Fund. I was introduced to the world of childhood cancer when our son was diagnosed with a brain tumor at just 6 weeks old, and now I have been working with CCR for over 8 years. And it's an amazing thing to be able to put that passion from our personal lives into a profession. And today I am joined by researcher Dr. Karim Sadak. Thank you so much for joining us today.
Happy to be here. Looking forward to it.
So I would love it if you could introduce yourself to our listeners and what you do at the university and how you got involved in CCRF.
Sure. So again, my name is Karim Sadak, and I'm a pediatric oncologist here at the University of Minnesota, Masonic Children's Hospital and Masonic Cancer Center. And I'm our director of our Childhood Cancer Survivor Program, where we take care of and manage research related to children who have survived cancer. So long-term survivors, kids who are usually at least 5 years from their diagnosis, or at least 3 years from their last treatment or something like a bone marrow transplant. And so I have been lucky enough to be the director of this program for coming up 8 years. And through that time, been able to work with CCRF side by side and really form a partnership for the care that we deliver for our childhood cancer survivors and how to make that care world-class, cutting edge, because of the research that CCRF has supported for us, our program, our collaborators, to really change the way we take care of children who survive cancer.
Well, we are so grateful for the partnership and all the work that you do. It's wonderful. It's been amazing to work with you for all these years. And I know, so I want to get to the heart of this topic of why cancer survivors slip through the cracks. And I know from personal experience, I know that you know from all of the families you've worked with all the years that they have literally gone through one of the probably most traumatizing experiences in their lives, fighting with this team to help save their child's life and getting through the treatments, getting through the protocols with all of the twists and unplanned things that come with that. And then they work so hard to get to this point of survivorship, and it's really heartbreaking to consider that they can slip through the cracks and that there isn't going to be that follow-up care. And I'm glad we're talking about this today, because I know it's a question that a lot of parents have, and certainly other care providers in your position. So I'd like to ask you, what do you see? What happens with those gaps, with those 3 to 5 years, depending on their protocol and when the follow-up should happen? What are the challenges there?
Yeah, it really is what we call multifactorial. So lots of different things go into how a patient and family who may have been used to coming, honestly, to the clinic or hospital 3 times a week or more frequently, and then eventually monthly, and then eventually quarterly, and then maybe every 6 months. At some point, it becomes a once-a-year visit to a childhood cancer survivor program like ours, but too many barriers come up to keeping that care continuous, right? So not allowing the patient to be lost to their follow-up or slip through the cracks of our healthcare system. And that's where it starts. You know, there really are a few different buckets or groups of issues that facilitate this happening. And it starts with the healthcare system. You know, we know as a child gets older, whether it's in adolescence or young adulthood, things change in how they interact, access, are treated, and back and forth communicate with our clinics, like scheduling, or even more concretely, like insurance and billing. Now that changes as someone gets older and insurance coverages change. Not to mention simple things like access to the healthcare system and how folks get here. It's one thing when you're a 3 or 4 year old and need that ride every single time. It's a different thing when you're a 21-year-old.
Right.
And you might have work or school and other modes of transportation that you rely on. And so there's definitely challenges across how healthcare is different when you're a pediatric patient or a child versus an adult, or even a young adult or older adolescent that's still considered pediatric. But we also know that there's also the challenge of within the healthcare system, how medical teams talk to each other.
Sure.
So one problem can be that childhood cancer specialist who knows all about this treatment and this particular patient's healthcare issues, when it comes to finding another specialist in the adult world, they may not have as good of communication, whether it's with a patient, a family, or each other as providers, which then also can become a gap kind of at the healthcare system level. So there's a lot of things, before we talk about the survivors specifically, or the providers taking care of them, there are challenges across whether it's a small practice or a large healthcare system. There needs to be ways to keep our survivors essentially safety nets from slipping through the cracks, because we know, like the things we talk about, there are barriers from very big picture issues as well.
I think that it's fascinating to me how much work still needs to happen, right? Just over all the systems combined. And I think it's interesting too, like you mentioned, that transition of their age really has a lot to do with it. So if you've got somebody that's transitioning into long-term follow-up when they are a young adult, I could see how that would be much more challenging than the 8-year-old who's still very, I don't want to say controlled by their parents, but they're gonna make sure, like, no, we've gone through all of this. There's so much more that we still need to do. And I've seen, and I'm curious if you've seen it too, and I'm guessing you have, that there are some families, when we get into talking about the survivor themselves, that really just want to leave it all behind. They want to be done. I've had the last chemo. I've had the last radiation. I've signed off. We're done with this. And that's a whole interesting thing too. But what are some of the reasons? And I know there's so many, so it's a big question. Why is it so important for us to find solutions so they understand the importance of that follow-up care?
I mean, that is a great point, because the issue might be different for an 8-year-old than a 15-year-old, than a 21-year-old. But across the ages, there is this phenomenon, and this is something we see every day in our practice, but something that's also been described in the research literature and in scientific journal articles, that this phenomenon of you're feeling well, you're not sick, you finished your cancer treatment, whether you're the patient themselves or the parent or caregiver, and that moving on feeling is actually empowering for many people, but it comes with that, at times, false sense of security, that you don't need the medical attention to either catch long-term treatment complications early or prevent them altogether. And that is a good thing, that a survivor is feeling well and healthy, but we can't let it go so far as to then become an avoidance or an avoiding behavior of receiving the survivor-focused care that we know they need. So it's that balance. We want our survivors to feel healthy, not have health concerns, not feel like they need a medical provider to address something specifically. But we also want to make sure we have the opportunity to deliver the education, to empower that survivor as they grow older, to answer their parent or caregiver's questions. So again, we can keep them healthy, or if there's health issues, we catch them early before they're serious. Not to mention the phenomenon of just about any adolescent or young adult, it comes with the territory that there's sometimes this feeling of invincibility.
Right.
And that's natural and comes with that age. But in a childhood cancer survivor, that that feeling of invincibility can't become a deterrent to getting the preventative care they need.
Sure, sure.
So there's a lot from the patient side that we can address as well.
And I think one of the key words beyond that invincibility, I mean, it's so apparent, like you said, even putting childhood cancer out of that picture. But education, finding the right tools or ways to educate them on ways that they understand and comprehend, but don't feel like it's more of a barrier, right? So it's more of like, we're trying to give you more invincibility. We're trying to give you more,
Yes.
right?
It's exactly right, because there's both ends of the spectrum. You have maybe the adolescent young adult who has that perception of invincibility, but then regardless of the age is the other end of the spectrum where there's the extreme fear, the fear of the cancer coming back, even though statistically that's so unlikely, or the fear of health issues getting back on the radar and becoming, that patient again. And so we definitely have a lot of educational messages that help survivors, parents, caregivers understand what the real risks are and what the risks that are causing fear or anxiety and are very real. I mean, frankly, it's very typical for a survivor or even their family member to have a post-traumatic stress experience after their childhood cancer treatments. And so we don't want to let that stress or anxiety keep them from coming back. And with the right educational messaging, with the right level of age-appropriate communication, we can calm most of those fears so that it's not so stressful to come back, or that the anxiety is lowered, versus being heightened when your mind can run wild because you don't know exactly what really could be the risks. So there's a lot that goes into the other end of the spectrum, which is the whole fear and anxiety and post-traumatic stress of childhood cancer treatments that keeps patients or families from coming back, for sure.
Well, and I've seen too so the timing is so important, because I know that you can only consume so much information at once. Like, when you've got a family on diagnosis day, the world is, they don't know what any of those words mean. They have no idea how they're going to follow this map and this journey. And so the timing, and I know they have to be in the right spot before they can even think about after this, right? But I know there's solutions to it. And then the burning question is, from so many care providers that are watching this, and caregivers, why is there the 3 to 5 year gap time, dust settle, before they start some of the follow-up regimens?
Yeah, a big part of the rationale behind that timeline is purely the risk of recurrence. So depending on the childhood cancer, in many cases, after 1 year, the risk of it ever coming back gets so low. But in most cases, after that 3 to 5 year period, the risk of a childhood cancer ever coming back becomes, statistically speaking, so much lower that the actual chances of getting a whole separate health condition from the treatments that cured that cancer become statistically more likely. And so it's all based, for the most part, on the risks specific to that patient and what their cancer was, what the treatments to cure it were, and then knowing when the chances of it coming back are highest, but also knowing when the chances of it ever coming back become the lowest. So then the shift of focus allows us to not think as much and deliver care as much addressing it ever coming back, because again, the chances of that happening are so low, but more so focusing on keeping that survivor healthy, keeping them in line for that age-appropriate health promotion that they need, and the preventative tests to catch things early that they need, because those become the actual risks that are higher, that are more real at that time period.
Right. Which is exactly why Thank you. Thank you for defining that so beautifully, because I know that from caregiver experience in the family relationships we have, that they literally feel like they're holding their breath for that 5-year mark, and they can go kind of dormant for a while and focus, as they should, on getting life as back to normal as much as possible, living, and doing all the things that they couldn't. But I know that they truly don't feel like they can stop holding their breath till they get that 5-year date, and it's very, very important to them for all the reasons that you just mentioned too. I think that there's a lot of opportunity, and that is why we're so excited to work with you and your program. Opportunities like the annual survivorship conference that we're seeing more of, more universities, more organizations that understand the importance of continuing that education, no matter where you're at in the spectrum, because there's always things that they can learn, right, to empower themselves in daily habits and behaviors, some of the emotional stress things. I mean, it really does touch every part of your life outside of, here's what our updated labs show, here's what we're watching.
That's a really important part, because as much as we stress as the medical providers about what is the blood test show for your white blood cell count or your hemoglobin or your platelets, or what does the heart ultrasound show, your echo, seeing if that has been affected by chemo, we realize that a survivor's well-being is more than just the number on the computer or the picture or x-ray on the monitor. It's about a bigger, larger picture, evaluation of well-being. How is school going? How is life at home going? How is the connection between the two and everything else around that, whether it's mental health or school function or family function or insurance issues, social relationships and well-being. I mean, the thing we have learned is the more and more research that's been done to learn about the medical issues for survivors of childhood cancer, there is just as many non-medical issues that can be on the radar. And now we have the expertise, the providers, the experience to also address these issues early and often, before they become serious, before they become too disruptive. What we all want is just the best quality of life.
Right. That's the goal, right? Especially after you've had such a crisis flip, into your lives. And you just were touching on this. I wanted to ask you, so if people are looking to support research like yours, programs like yours, what should they do? What should they be doing?
Yeah, the big thing to realize is that we, of course, still need more and better cures for childhood cancer. But we can't stop at just cure. Like I was just saying, the end goal here isn't cure at any cost. It's cure with the best quality of life possible for that patient for the rest of their long, long life. So I really urge people who want to make a difference for children with cancer to keep in mind that there is a need across their entire lifespan, from the day they're diagnosed till the rest of their life, to have an impact on improving their quality of life. And that's where research is needed, again, of course, to find more cures and to find better cures, but also to find better ways to take care of these survivors as they grow through adolescence, into young adulthood, and beyond. And that's a really important part of the research that we do. It's not measured in survival rates or cure rates, but it's measured in quality of life, keeping these survivors in the system and not letting them slip through the cracks, so we can provide the interventions to really maximize their quality of life and do that forever.
Yeah. I don't think there's one family that would disagree with that statement. And there's so much importance in that. And thank you for sharing that perspective as well. Because yes, we're raising our hands. Yes, that's what we're talking about. And finally, what do you wish more people knew about childhood cancer? And maybe there's something else that comes to mind.
I think it's worth highlighting that there are real health issues that can happen as a long-term survivor. We know the statistics show a majority or 2/3, 75% of children who are cured of their cancer will have some health issue as they grow older. But at the same time, research and statistics would show that only a minority, 20, 25% of these childhood cancer survivors will grow up and end up getting the survivor-specific care that they need, like I said, to either prevent these health conditions or to catch them early before they're serious. And so you figure if only 1 in 5 kids is getting the care across the rest of their life to really prevent that other shoe from dropping or to catch it early, that's not acceptable. We can't let that be the case. And so, of course, we need to find better and more cures, but we also need to find ways to take care of these survivors for the rest of their life. And that's something people don't realize. There are medical teams, healthcare professionals across all the disciplines, the childhood cancer specialists, the psychology or mental health specialists, you name it, that partner with these children and families for the rest of their life to have that journey where they're not alone, but they're with someone who knows what they've been through,
Right.
and knows how to keep them healthy through the rest of that journey, wherever it takes them. So I always like to highlight that. It's just, you're not cured and done.
Well,
You're cured and you have a team.
that's a jaw-dropping percentage. That is 25% is what you said. That's attention getting, and we're excited to increase that number, right, in all the ways that we possibly think we could. I think, thank you for sharing that. I think that's very eye-opening for families, medical providers, anyone that is in the world of childhood cancer. Thank you so much for your time today, for your work with these amazing families. I know from our position, we wouldn't have a clue how to charter the aftermath of childhood cancer in the empowering ways that you have given our family personally, but other families that I know that you work with. So we're so grateful for your work and your time today. I know you have a busy schedule and lots of families waiting for you for your care. So thank you. And then I also want to share that you can learn more about your amazing work in the link that will be in the description with this interview. So thank you so much for your time today, Karim. Bye.